Welcome everyone to our training this evening. This is a conversation with Magellan part 1. The second part will be happening on October 20th, and this is understanding Medicaid for dual diagnosis and intellectual disabilities. So just for our quick disclaimer here from the ARC of Lehigh and Northampton counties, the ARC of Lehigh and Northampton counties advocacy department does not employ lawyers nor provide legal advice. This training or any other provided by the ARC's advocacy department does not constitute or imply endorsement, recommendation, or favoring of the providing party or any employees or contractors acting on its behalf. This webinar is being provided for educational and informative purposes only.
Thank you very much. Okay, so again, my name is Tom Walker. I'm the Senior Account Executive. I work for Magellan Behavioral Health of Pennsylvania. We're a behavioral health managed care company that is highly specialized within the Medicaid delivery system for behavioral health needs. And when I say behavioral health and behavioral health services, we're talking about mental health care, we're talking about substance abuse treatment services. And our hope today is to really talk about the behavioral and the mental health treatment, which are critical for people with intellectual and developmental disabilities. And we want you to understand through these two-part sessions, what is Medicaid all about? Why does Medicare matter? How does being a Magellan member factor into this equation? And most importantly, how do I get support through the entire process? So today I'm joined by John and Steph here at Magellan. I'd like to open up John to offer any introductory comments. Steph, the same. John?
Thanks, Tom. And thank you so much for having us here. We're excited to be able to talk with all of you. My name is John Lees. I'm the member and family advocate for Lehigh Northampton County. Just a little background, I've been with Magellan for, well, since 2003 now. So inching up there towards 20 years in a couple of different roles, and been in this particular role as a member and family advocate for since 2016. So over 5 years now. Have had a lot of wonderful opportunities to partner with the ARC and the team there, and both for opportunities like this in terms of presentations and being able to meet and talk with all of you and hopefully share some information and learn some things too ourselves from your guys' perspective, but also individually on various cases where there's some overlap. So a good example of, kind of the goal for this evening, which is to, as Tom kind of outlined, really be able to kind of provide for you some of the basic nuts and bolts, get a little bit more into what kind of resources we have, where you can find those resources, and when you're maybe having some challenges with the resources or not sure what to do, how you can get in contact with us. So thanks again, and looking forward to the conversation.
Hi, everyone. My name is Steph Casanis. I apologize. I have a dog in the background if you hear anything. I am the Recovery Support Navigator for Magellan Healthcare in Cambria County. I'm here in place of Janet Verga, who was unable to attend tonight, but she is the Recovery Support Navigator for Lehigh Northampton. I've been with Magellan for just under a year, and I spent 20 years working community-based mental health for a local Cambria County community-based mental health provider. So I do have a lot of experience in this. I'm a certified peer specialist, and I'm very happy to be here. Thanks for having me.
Thanks, guys. John, we can move forward with the learning objectives. Thank you so much. So again, today's discussion is going to provide an overview about Pennsylvania's Medicaid program. We want you to kind of understand what Medicaid is all about. We'll tell you more about Magellan Behavioral Health of Pennsylvania and define that roadmap about how to access services, take advantage of advocacy and support for when you need assistance and help, and opportunities for self-advocacy and advocacy for others, which is a defining and important process for person-directed supports. So let's go ahead and move forward. So about Magellan Behavioral Health of Pennsylvania. We are a behavioral health managed care organization. We serve here in Pennsylvania 6 counties. These include Lehigh, Northampton, Bucks, Montgomery, Delaware, and Cambria counties. Our website is www.magellanofpennsylvania.com, and we'll be touching upon various aspects of the behavioral health delivery system, including help with navigation, answering questions, coordination of referrals, and some of our focus areas, which includes addressing the needs of people with intellectual and developmental disabilities. One of the things I did want to make mention at the start, when you become a Magellan, when you enroll in medical assistance and you get signed up with Magellan as a behavioral health managed care organization, we consider all of our participants in the program to be members. That's indeed what what it means when you get enrolled in our service and system. And membership carries with it certain rights, which are codified into the Pennsylvania's Mental Health Procedures Act, and also codify certain responsibilities. And under this program, what we're talking about is something known as a health choices program in Pennsylvania. That is what Pennsylvania defines its medical assistance program and its Medicaid program. It's called health choices. And that point about choice, member choice, and informed choice are some of the key themes and one of the key takeaways we hope that you glean from this discussion as you help your loved ones on their recovery journey. Go ahead and take the next slide, please. All right, so Medicaid 101. This is sort of big picture. So we're going to start at the largest level. I'm assuming virtually no knowledge about medical assistance and Medicaid program, but it is the largest health insurance program in the United States, covering nearly 71 million people, and was enacted back in 1965. And one of the largest programs, especially for children and children's health care in the United States. Why this matters is all of the services which we're providing are sourced ultimately from federal tax base, and these dollars are also complemented by state dollars and local dollars. So as citizens together, we have designed these services to be an essential safety net, that healthcare is accessible, it is affordable, and indeed within the Commonwealth of Pennsylvania, when the Affordable Care Act rolled out, one of the states that also adopted the health choices in the Medicaid program as part of the expansion of health insurance and health coverage. Individuals qualify for medical assistance based on two categories. One is a needs-based category, meaning a financial reason, and a financial reason could be up to 130% of the poverty index for the community. So this would be lower income, but it is also designed for individuals that possibly children that have a disabling condition. Let's say the parent has commercial or private insurance, can also get medical assistance coverage to pay for services which wouldn't be otherwise covered under the primary insurance plan, or may be subject, the family members may be subject to high out-of-pocket costs. So Medicaid can help cover those out-of-pocket expenses, can cover supplemental services which don't exist elsewhere, and were designed specifically to meet the needs of people in various categories, including individuals with intellectual or developmental disabilities. It's also heavily regulated, and because this is a large co-op of federal, state, and local partnership, you also have that essential feature of providing voice, lifting that voice up through the local elected officials, or in certain conversations like we're having tonight. So please don't be shy with the questions. And thank you also to Jess for reminding, we will be pausing for questions as we go along with things in more real time after we close down the official recording of this webinar. So that conversation is super important. So Medicaid in Pennsylvania, as I shared earlier, in Pennsylvania, the medical assistance or Medicaid program, I'll use those terms interchangeably as we continue this discussion, is also known as Health Choices. Health Choices has three primary programs. One is called the Physical Health Choices Plan. Here in the Lehigh Valley and really across the Commonwealth, you have a choice of various plans which have slightly different benefits. They're mainly the same, but there could be certain differences in the benefits across the plans. But this covers things like dental appointments, physical health care appointments, pediatric appointments, or primary care appointments. Covers the cost of medications, of transportation through the Medical Assistance Transportation Program, and certain things like lab tests. Those are all covered under the Physical Health Plan. Here in our Lehigh region, we have 5 physical health plans. This could include programs like Aetna or AmeriHealth Caritas, United, and there are other, UPMC is another. And so there are a wide variety of physical health plans for which individuals can choose. If we click on, for example, any of these links, this will bring you to the Commonwealth of Pennsylvania Department of Human Services website, where you have direct access to the member services contact information and the websites for all of the plans. And so that applies equally to all 3 links here that are demonstrated. The second type of health choices insurance is known as behavioral health choices. Behavioral health choices is a component of the Medicaid program. It is not something that individuals choose, but it is based on your county of residence. And so Magellan is an example of a behavioral health managed care organization that operates the Behavioral Health Choices program in partnership with the local counties where you live. So if you live in Lehigh County, and Magellan is the behavioral health managed care organization that is a partner with Lehigh County, you will automatically, upon enrollment in Medicaid, be assigned to Magellan. That could be different based on what county you live in. And so that's where it is important, especially if you're planning on moving and you want to transfer your benefits. It's a great idea to find out who is my behavioral health provider for that continuity of care, and to be able to get access to information about those covered benefits and make some preparations before you move. And then there's the third component of the Health Choices program. It is another physical health choices plan. This is known as Community Health Choices. Community Health Choices was designed and implemented beginning 3 years ago here in the Commonwealth of Pennsylvania. It began really with looking at addressing the needs of individuals that have long-term support services needs. This could be, for example, individuals that are in congregate care, living in a nursing home, in a supported living or a community residential program funded by the county or funded by the state directly. And often individuals have Medicare as the primary insurance. The Health Choices program does not replace Medicare, but supplements it in the exact same way as I had shared previously. If you have a if you have a primary health insurance plan, like from your employer, and you have a disabled child, you can apply for Medicaid in Pennsylvania and get those covered benefits. The same applies with Medicare, that individuals who have Medicare that maybe could not prior to Community Health Choices participate in all of the supplemental services, all of the programs which are uniquely designed for individuals with intellectual or developmental disabilities, can now access those services because Community Health Choices is now allowing for that opportunity. So it's great that we have been able to join forces and deliver additional supports and services to meet the needs in the community. Now, how do you access this is a great question. And one of the best ways of enrolling in the county is enrolling in medical assistance here in Pennsylvania is to either use the 866 number, which is up on the website or on the screen here, 866-550-4355, or visiting compass.state.pa.us. You can also visit what is known as a local county assistance office if you'd prefer to do that in person. I have found, though, personally, that the website is very easy to manage and navigate. You can upload any proof of eligibility documents, if it's proof of disability for a child, or it is income eligibility, or things like identification. This can all be securely transmitted directly to the Commonwealth of Pennsylvania, and you can track your application status and decision in real time, as well as to get expert support along the way. Often the hardest part is opening up that door, but once the door is opened and you're secured, there is then an annual renewal process, and the Commonwealth of Pennsylvania is really excellent about communicating the status of insurance and the coverage of benefits. So rather than share a very lengthy mission statement with y'all, I wanted to share Magellan's motto, which is leading humanity to healthy and vibrant lives. The essential message here is your health matters, your family's health matters, and we are here to help. One of the things before I hand this over to John to take a little bit of a deeper dive into the services is really one of the most compelling reasons that we are here today is that, you know, a significant portion of people with intellectual or developmental disabilities with or without psychiatric diagnoses do require behavioral health support services to help them improve either adaptive skills, their positive functioning, it's been fairly proven that a smaller or nearly half, you know, a smaller number, but still nearly half of the people receiving IDD type services are formally diagnosed with a co-occurring mental health condition, and the services are not utilized at the level that we would like them to be. So we have been really interviewing a whole lot of people, our stakeholders, our treatment providers, the counties in the state, to try to design opportunities to be able to close that gap for getting additional information and support and adequate training and comfort for both the providers and the family members. So I just wanted to thank everyone again for being here, for hearing us out. And John, I'm going to hand things over to you to continue this discussion.
At this point, we're going to kind of dive into how someone would go about getting services. So Tom gave a really comprehensive idea about the program, kind of the tenets and the scope of the program, some of the really key things you need to know before you get into actually accessing services and supports through the Health Choice program, and specifically with us at Magellan. So you see there, that's the question. So if I'm a member, or maybe I have a child who's in need of services, you know, what do I do? What are my first few steps? One thing that's important to know under this, under Magellan and Health Choices, you can go directly to an in-network provider to ask for care. We're going to talk about in-network versus out-of-network in a minute here. But that can be a direct call to inquire about services. Perhaps the school or another healthcare professional or practitioner has suggested seeking out services for yourself again, or maybe for your child. You can make that contact directly. And how you find one of our in-network providers is there's a couple different ways. And we certainly want to play a role in supporting folks being able to get connected. That's a lot of what I end up doing, is that kind of front door. how do I get in through that front door to access services? So Tom had mentioned our website for members. It's the Magellan of PA website, and you see that link there. You can go to that website, and in a couple of slides, we'll get a little more into our provider search tool. But on the site, and we have a screenshot of what it looks like, but on the site, you can search for a provider through our provider search tool. So you can look for different types of levels of care or services, depending on what's being recommended. And if you have any difficulty with that, if you're not sure of that first step, you can call one of our customer service representatives. There's other kind of ports of entry as well. As I mentioned, I get a lot of contacts from families or members themselves seeking services. We have single points of contact for our clinical team. They too can be a resource for that first call. Maybe there are questions before you call the provider or start looking through the provider search tool that you might have, and we can help to answer some of those questions, kind of explain what you can anticipate with those first few steps and once you get rolling with services. So again, we'll provide you with how you get connected to us, the actual phone numbers and so forth. But I guess the takeaway I would like you to walk away with is there's really no wrong door. You should be able to contact us through any of these kind of platforms, connect with one of us, and we'll do our very best to answer questions, make sure you have the information you need. If there's a reason for a second call or beyond that, we're certainly available for that. It's not kind of a one and done. It doesn't have to be. So now when you're thinking about getting care, one of the questions you may also have would be, what's the appropriate care? What specifically might I need or might my child need? And again, you may already have some services that folks have maybe suggested based on their experiences or their kind of what they do professionally. If it's a pediatrician, developmental pediatrician, perhaps. It could be through the county, through school, as I mentioned. So one of the first things to remember, to know, is that our providers of all of our services will work directly with you to figure out and assess and evaluate what level of care is going to best meet your needs. So you may have had some suggestions about accessing services for your child. You'll take those first few steps, and the first provider you'll connect with will do an evaluation. They may recommend that service, or they might recommend a different service, but they're going to have a conversation with you that's based on their clinical assessment and evaluation about what's needed. And we'll actually talk about getting a second opinion in a minute too, which is an important thing to be aware of. I mentioned we have our in-network providers. They will, and you don't necessarily need to do anything, but we want to make sure you can understand what's going on behind the scenes. So there are certain services that they have to get approvals for through Magellan, or what we call authorizations, and they'll take care of doing that. So as you're getting connected with them, so that they can make those recommendations for what we call medically necessary, or what you clinically need, they'll be in contact with us, make those requests through our clinical team, and assuming there's an approval, they'll move forward. And as I mentioned, generally that's going on behind the scenes. That's not something that typically you would necessarily get involved with. If there's any kind of maybe they're not necessarily seeing things the same way, there can be additional discussions, and you may get looped in. But that's kind of a second tier of this training. As I mentioned, some services do require an evaluation or a pre-authorization. And if we don't have, for the particular level of care, an in-network provider option, maybe there's a need for a specialization, which sometimes happens with folks diagnosed with an intellectual disability. Not all providers have all specialties. So if we can't access through our in-network providers, then we will work with you, have conversations around looking into what we call an out-of-network provider. And all of those would be discussed with our clinical team. We loop in other departments like our network team to try to make sure we can make those agreements with the provider and get those services in place. That's the most important thing, is if there's something that's needed, If there's a recommendation for a service based on a clinical evaluation, we hope you'll be able to access it through an in-network provider, but you may not be able to, and that's where we can come in and try to help and assist with that. Just to give you a little bit of a quick 101 on the difference between in-network and out-of-network, and why we really would prefer in-network, frankly, is we work with them very closely. They're very accustomed to how the services are to be delivered, kind of the process and protocols. And we just have those established relationships, which is to take nothing away from any out-of-network providers. If we need to, we can provide them with technical support. If that's the arrangement we're going to establish, our clinical team is very accustomed. We have folks that this is what they do. They work with our out-of-network providers, frankly. And that is kind of their role, is to not only talk about the clinical needs and whether or not this will meet the threshold to have an out-of-network agreement, but also too, do you have any questions around the process, the technical aspects of that, so that again, it's ideally as seamless for you all as possible and as timely as possible. And Tom kind of touched on this as well, just talking about the funding and benefits. So as someone who would be a medical assistance recipient, there are no benefit limitations. So what that means is we have, and I always describe it this way, we have kind of a menu of services through the Health Choices program, and that we offer in Lehigh, Northampton County and the other counties where we are working with those counties. And then we also have supplemental services, and Tom referenced this. So these are things that are specific to this particular area and that we've added to that menu, that list of services. As long as you or your child meet criteria, meet the medical necessity criteria for those specific services, then there's no cost. There is no cost for anyone who's a medical assistance recipient to get those services. So there's no limit as long as you're meeting the criteria for the service, and there should be no out-of-pocket costs to receive those. And again, that all occurs kind of behind the scenes between us and the provider. They will provide the service, they will bill us through our claims area, and the vast majority of times everything's in good order, so that claim gets paid. And again, you're just continuing on with those services, or your child is. I mentioned earlier, if you are getting an evaluation either for yourself or your child, and they make a recommendation for services and you don't agree with that, you do have the right to request a second opinion. And what we'll do is, once you notify us that you'd like to take this step, we'll work with you to identify another network provider. Again, there's no cost, even if it's a second evaluation, the very same service, because this is something you can ask for. And we'll make sure that that connection is made to get that second opinion evaluation. And then again, last thing on this particular slide, Tom had referenced other insurances and having those at the same time as having Medicaid. So things like Medicare or another maybe commercial insurance through an employer. Anything that's uncovered after they bill those plans is something that Magellan, the Medicaid Magellan, can help to cover those benefits that aren't reimbursed. So, so again, it can be a super helpful additional resource in those situations where you do have a primary insurance and Magellan is secondary, to ensure that there's no cost, no out-of-pocket expense. So that was a lot of information. I'm going to pause and see. I do see a.
Yeah, we have a question in there, John.
Okay, sure. I can't see the chat right now. Can you?
I'll read it to you.
Diana
is asking, where can I get more info on supplemental services? Please talk more about this.
Sure. In our member handbook, which we're going to get to the website in a minute, but our website has a lot of wonderful resources. And one of the things it has is our member handbook. Our member handbook has a full list of that kind of menu I described, both what are the like kind of those in-plan services, and then what the supplemental services are. So to give you an idea of a supplemental service, and Tom, keep me honest here, CRR host homes are foster care homes that are considered a supplemental service. It is through Health Choices approved in these counties for us to be able to contract with CRO host home providers. And these are specialized foster cares for children with mental health needs. We have different providers who provide those services. And that would be something that was identified as a need in this particular region, in this area. And so we worked with our county, the folks at the state, the Office of Mental Health and Substance Services, or OMSAS as we refer to them, to establish that particular example of a supplemental service to help meet the needs that were identified. They follow very much the same process, and we have oversight. It very much operates in a similar fashion, but it just wasn't on that original list, or what they call in plan. And so over the years, they've added different supplemental services. So hopefully that answers that question.
John, a couple things if I could go ahead and add.
Yeah, please.
Yeah, so we also will be, as I mentioned earlier, we're going to have part 1 and part 2 to this conversation. So the part 2 that's coming up on October 20th is really going to be very highly specific to the behavioral health conditions. You'll be working and meeting with our care managers that help guide and shape some of the medical necessity reviews, and work directly with the providers to deliver these services. But we'll be discussing, what does that look like from a family member's perspective? What are the clinical signs and symptoms I should be most concerned about for making connections to either the in-plan services, be it and really in-plan services, you can look at it in 3 ways. This is going to be at the highest intensity level, like a hospital program, like a psychiatric hospitalization. Somewhere in the middle is going to be residential programs. And so this could be children's residential programs, and we have some specialized residential programs for kids living with autism or with an intellectual disability. For adults, the residential programs could be, or the CRR host home like John was talking about, or for adults, it could be like a drug and alcohol program or a long-term structured residence. And then at the lowest level, which is really preferred, are the community-based services. And a lot of our investments have been moving in that direction with the supplemental programs to equip people to live within communities of choice and to be well supported. And some additional supplemental programs that I'm sure Danielle will be talking about on the 20th would be things like DDTT, that stands for Dual Diagnosis Treatment Teams. It's an intensive treatment team approach that delivers a skilled therapist, a behavioral health navigator, a psychiatrist, counselor that really works with individuals in community settings and brings the treatment into the homes. Most recently, we have applied to reduce that age range from 18 plus down to 16 because we've heard that family members want that support to help prevent a crisis. And there may be access concerns, or there may be other safety concerns. The second supplemental program, now this is really highly unique for Lehigh County, but I think it's important to share, is our 2-to-1 applied behavioral analysis pilot program. While it started as a pilot, it's now really an official program where 2 therapists can come into the home under an applied behavioral health analysis ABA treatment modality and work with families to transfer that skills and prevent a placement in a residential treatment facility. Another example would be things like psychiatric rehabilitation. This is a community-based or a mobile model that can deliver and teach skills to individuals after a lot of the children's services sunset at 21. Let's say because of the developmental delay, that just didn't get on with attaining independence in living, learning, working, or volunteering or socializing. We can get therapists in either site-based programs or mobile programs to come into the homes, work with individuals, particularly those with autism, to learn and to acquire those skills, prevent or mitigate some of the loss of personal agency, which has occurred because of the developmental delay, and just get people caught up and healthy and functioning to their maximum capacity. So these are just a couple examples of the supplemental programs. And again, we'll be going through a little bit more of that tonight, and definitely on the 20th, really a deeper dive into that.
Thanks, Tom. Okay, so here's some important information. I mentioned earlier our member services team. You can see that they're sorted by county. These are the counties where we operate in Pennsylvania. And that is a number, those are numbers, and we'll make sure that you get this information. These are staffed 24/7. So depending on your schedule, you may not be able to necessarily call during the day. These representatives are accustomed to fielding questions from the ones I mentioned earlier. I'm trying to access care and I'm not sure, what providers I can use. Or I'm trying to use a provider search tool on the website and I'm having some difficulties. Or they can transfer a call. If there's a greater clinical need, they may pass it to a clinical team representative, which would be a licensed practitioner who could kind of triage that question that you might have and provide you with some information or suggestions about steps you can take. So again, it's 24/7. Even though they are separated by county, I will share, you call any of those and you'll get through to the member services team and they'll make sure that you get the right information related to where you are. Also our website. So this is the screenshot I mentioned earlier. So when we talked about those first couple of steps, I mentioned the provider search tool. This is what that looks like. So what you see here is what you would be seeing on your screen if you were to be using the provider search tool. And it is a tool that you can see at the bottom there, you can enter your zip code, you can pick the distance, how far you want to travel. And then there are a number of other filters you can use. Things like age, if it's for a child, and that's broken down by early childhood right up through adolescence and then adulthood, and even older geriatric ages, by gender, and then you can sort by specialty. If you're looking for a particular provider who may have a certain specialty, and then things about the practice. Do they have weekend hours? Do they have evening hours and so forth? So, if you have a interest in checking it out, it is very easy to use. As I mentioned, if you get stuck using it at all, or it's maybe not giving you options that are working for you, you can contact the member services team. You can contact your single point of contact. I'm going to talk about that in a minute. You can give me a call. Again, there's really no wrong door. We want to make sure that we understand if you have a question or you're having a need, and we're responsive to that. So this just kind of highlights some of the really helpful information that you'll find on our website. So, it's very much geared towards providing information, providing resources. This is just kind of some of the key pieces that you would want to know if you were a new member. As you move forward, once you're a member, there's wonderful resources by county. We have a whole library of clinical, with a lot of clinical information and resources on there. So it's really a great resource hub. And it's just a matter of figuring out what you're kind of looking for. And if you're not finding it, on every page you'll land on the website, you'll see the member services 800 numbers. So feel free to give them a call and they can direct you to where you'd find that. We really, we know in this day and age that people want to use technology and be independent in kind of the steps they're taking. And that's, we're supportive of that. So we've really tried to make it as user-friendly as possible. If you have feedback about the site, we're very wanting to know that as well. If there's enhancements you could suggest, we'll absolutely take a look at that. I can share with you, since I've been with the organization, it's changed many times. And most of the changes have really been driven by the feedback we've received about its utility or adding different resources, making things easier to find and so forth. So, I would describe it as a work in progress. always, because it should be up to date, it should be active, and we should be staying on top of what's there. Again, some of the things you'll see when you go to the site, that welcome letter that I mentioned, when you are enrolled with medical assistance here under Magellan, you'll receive a packet of materials, and in there you'll see a welcome letter. In that welcome letter, there's a lot of really helpful information. My contact information is there, both my direct phone number, my email address. We have what we call single points of contact for the clinical team. So if you're an adult who has a clinical question, perhaps, you'll be able to find who it is that you can contact and how you can contact them. If you have a child and you have a question related to the services, again, same deal. There's a team member who is on the clinical team whose responsibility is to be that single point of contact. We call them Spock. So that's a wonderful resource that we built out a few years ago. Again, just trying to make things a little bit easier to navigate. And so that letter just gives some key. It's not too long. It's some key information, key contact stuff, and then from there, again, I always suggest folks check out the website if you need anything beyond that. I also mentioned earlier our handbook. Our handbook is on our website. It is the full comprehensive handbook. It has everything from the services that you can receive, your member rights and responsibilities, what you should expect from the providers, kind of step by step about the process. There's a lot in there. It also has information about the physical health plans if you need to get in contact with them. It has things on advocacy resources, whether it be maybe educational or legal, just to give some of the information from this area. So it's a great resource. It's right there on the website, and I encourage folks to check it out. Maybe even save that link in your favorites. Going down to getting the appropriate type of care, we did create for individuals and families with children with autism what we call our navigation guide. This was a product of our Autism Action Committee, and our Autism Action Committee was a 3-year committee. It's still ongoing, and through that committee, and it included Magellan folks, myself included, and Tom. We had families and parents of children with autism who participated, and we had our county partners there, and from time to time we bring in providers. One of the things, we did a lot of things. We looked at what services were currently available and where we could build some of those out. We enhanced some programs. It really was a wonderful and continues to be a wonderful resource. And we are always looking for families to get involved with that. So if you have an interest, by all means, let me know, because this navigation guide that I'm talking about now, which is also on our website, it has some of the kind of basics of the first few steps. So if you're a parent and maybe your child is newly diagnosed, with everything else that you'd be kind of trying to navigate, it would provide you with some very concrete basic steps to take. And it also has a wonderful array of services and resources for folks in this area, online services, parent support group information, and really it was designed by the families on the committee. We had some very grand ideas, but what the families really let us know is, what you really need is some of the basics, and that's the really key and critical information. So again, something else on the website to check out. And then just lastly there, just wanted to make sure you walk away understanding that providers will work with you if you or your child or children are getting services or need services. The provider is going to work with you around what services best fit your needs. And so, they'll work with us on the clinical side around getting the approvals and some of those kind of nuts and bolts of the procedure. But if you have questions related to those services, either what's been recommended, maybe you're already in services and there's an issue or a concern or a question and you've tried to address it with your provider and it's just you're not getting the response you're looking for, that's where you can reach out to us. And again, we want to understand what's happening and try to identify some solutions, whether it's finding a different provider, troubleshooting, with your provider, whatever the issue is, whatever it is, we want to be actively engaged. And it's hard to know if there's issues if we don't hear from folks. So I always encourage folks, even if you're not sure, you can reach out. And one of the questions we'll ask is, if we're trying to come up with a solution, do you want us to make your provider aware? Some folks don't want them to be aware. They're just looking for some ideas or suggestions, and that's fine. We don't have to. We can have a conversation, give you some suggestions, and hopefully, bottom line, help you get the most out of those services. That is the goal. And before I, pass it to Steph, I just again wanted to mention that as Tom mentioned, our second part of this conversation will very much get into that deeper dive of specific services. So hopefully what you walk away with is, okay, if I have folks who are suggesting I myself get services, or my child, or maybe I just feel like I need to access some support, some behavioral health support, give us a call, reach out. Again, we want to be available. We want to try to help with taking those first steps, but also we'll remain engaged. I have folks I talk to maybe 1 or 2 times, and then they're on their way, and that's a good thing. And I have folks I've talked to for a couple of years, and they'll check in from time to time, and that's okay too. So whatever your need is, we want to make sure that we're addressing that. So, and with that, I will pass it to Steph to talk a little bit more about getting involved and being engaged.
Thanks, John. So again, my role with Magellan is Recovery Support Navigator. And as the Recovery Support Navigator, I am in a very member forward type role. So I engage with members almost daily. And it's my job to connect and to link and to support our members and their families in, being able to access the services that they need, and then being able to, be fully engaged in those services. So, in my role, I spend a good amount of my time involved in the different community type organizations that we have that we're involved in. Like the slide says, things like the work groups that we have. So things can be county specific, but some of the opportunities to get involved are things like community support program, where that is members who get together, consumers and their families to discuss, needed services, maybe deficits in services, things like that. And they usually meet monthly in each county. There's a consumer family satisfaction team and that would be some of the surveys focus groups that they're talking about there on the second line. That's a group of individuals, again, consumers and family members who through surveys of other members determine what services are working, maybe what services aren't, maybe what services are lacking. And that's kind of how we go from there to decide to add some of those supplemental services or some of the things that we might be missing. There's an opportunity to be involved as an advocate and serve on our complaint and grievance hearing panel. So if an individual or a member is denied a service or is denied a certain level of care and a complaint or a grievance is filed, we have members and family members serve on those to get that perspective also from them. Again, it's our goal to help our members live the healthiest, most vibrant lives that they can in the most independent way possible with the least restrictive services necessary. And as the Recovery Support Navigator, it's my job, my goal, and as somebody who identifies as having a mental health diagnosis and who's someone who's been served in the system, to ensure that our members do have the voice, the choice, and the services that they feel that they need and access to those services. And I also work with family members often for individuals who maybe are inpatient at the time or have another reason that they can't engage, to assist those family members in getting the services that they feel that their family member needs. I think I did a pretty good job explaining what Recovery Support Navigators do. And that's kind of what I was going to go into on the next one. But again, just my role is to ensure that our members have access to the services that they need, that those services are providing, that they are getting the services that they expect, and to help to support if there's any gaps in those services. So if there's a time where, maybe there's a wait list or somebody can't get a service right away, to provide extra support to our members and to our members' families to cover those gaps in services that might happen. And I am not the recovery support navigator for Lehigh Northampton. Janet is, but we all serve the same role, just different resources in different counties, but we serve the same role. So Janet would be available for any, concerns or for within Lehigh Northampton.
And I'll go ahead and just jump in there. I want to share a little bit more specifically about what I do. So also, I also work very member facing. So I'm speaking with members and their families every day, who have reached out for a variety of needs, whether it be questions, basic questions with that starting in services, to concerns with providers, to issues with other parts of the system, but it's affecting their behavioral health services or their child's behavioral health services. That could be educational, and so we really try to partner pretty heavily with our folks through the county, through the different systems and departments, educationally as well. Like I mentioned earlier, we work pretty closely with folks at the ARC as well. There's often a lot of overlap. So, but my role really in a very basic way is just to help to provide information, answer questions, hopefully help folks be autonomous and independent in getting services and getting the most out of their services. If they're not, if you're not, or your child is not, then to help advocate, whether it's internally within Magellan, if we need to do more, whether it's connect with a clinical team person and get them engaged with a family or a member to move things forward, or through our complaint and grievance department, which I work pretty closely with. Whatever that issue is, again, hopefully making sure that that the service is going to meet the needs and that there's nothing getting in the way, and that we're doing our part to make sure that experience is positive, and focused on recovery, and that folks are being respected, and that we understand how we should treat people and the things that we should be doing to help. So that's in a very basic way, that's what I do. You see my information there. I mentioned earlier, that's my direct phone number and my email. I've probably since COVID, I've gotten more probably email than I had previously. Whatever folks are comfortable with in the way of communication is completely fine with me. I try to respond as quickly as I can, even if it's, I received your outreach and I'll be in contact, whatever that is. So.
There is a quick question in the chat.
Okay.
They're asking about the service pages in the handbook. So if you can give them the page number, possibly, about the supplemental services. Do you guys know the page number by chance?
I don't.
Okay.
But when we move on, I can look for that and see if I can get that before we wrap.
All right, awesome, thank you.
We also have a printed provider directory. Within that directory, we list all of the services that we fund, which include the full listing of the providers which have contracts for each of the counties, both for the core services and the supplemental programs. That would be a great discussion if you look and you do some research and you'd like more information about any of the services that you see in our directories, or as you scan on the website or the handbook. If you have a question at any time, there is never a wrong time to pick up the phone, call a member services rep, and ask for more information and get some clarification, or reach out to the provider and ask as well. But I think probably the most direct way to get at least the local provider information about the supplemental programs would be directly from our print directory. if that makes sense. And I can put that information for all of our counties into the chat as well. So.
And that, Tom, just to add to that, that provider directory is on the same drop-down menu as a provider search tool I referenced earlier. So where the provider search tool is using your zip code and other filters, the provider directory, as Tom mentioned, has a comprehensive full listing of all the providers in the network by level of care. So whether it's in plan or supplemental.
Yeah, and so what we try to do for the supplementals is just describe them, what they are. These are really known as supplementals, are known as in lieu of services. And so it's not going to really neatly fit within the inpatient, residential, or outpatient services, those three kind of distinct levels, but really solidly live mostly within that community-based services. And they'll have names that don't look like mental health outpatient or drug and alcohol inpatient or outpatient services. You should be able to identify them, but there's not going to be something that says this is a supplemental. These are covered benefits for our members, and we want folks to use them all. But again, if you ever have a question, it's really super easy to pick up the phone and call us 24/7. We want you to do that. I think our final slide was the announcement of the October 20th, discussion.
Great. Thank you both, three of you actually, so much for your presentation this evening.